We're going to do a couple of things right now with the sciatic nerve, the lower branches of the sciatic nerve as they come down here through the knee. Remember, a lot of people who have that pain down in the popliteal space, you know, the tibial nerve runs down through there and peroneal nerve kind of branches off. Remember that the tibial nerve is a lot bigger, over twice probably the size of the peroneal nerve. And the peroneal nerve can imitate shin splints, true shin splints, tibialis posterior problems. And tibial nerve can imitate Achilles tendonitis sometimes. It runs right along under gastrocsoleus, and so you get a lot of false positives on your tendinopathies that are really nerve problems. So this is also just a basic sciatic stretch. Remember that we did it from the side. We already did our sciatic nerve stretches sideline, which I still prefer better because you'll see why right now. This is kind of a problem for a lot of small therapists trying to lift a heavy leg. You not only got to lift it, but the best way to kind of get a little bit of leverage is once you get it off the table like this, you're still braced against your body, you come in right here ready to dorsiflex. So you already get yourself in position here, then you get your shoulder under it like this, right? So now you've got it. So now this is a typical sciatic thing where you're just barely bringing it up to barrier to see if there's any symptoms. So a lot of your sciatic people are down here. So here's what we're going to do. Bring it up to barrier. For peroneal, remember, recall how it's coming. It's coming around right like this, around the lateral malleoli. So you want to stretch it, you're going to want to pull it away, right, like this. You're going to want to invert the foot like that and supinate the arch, right? Pull the arch up so it does that. Can you see how that's what we're trying to do? So here's what it looks like here. We're going to dorsiflex, we're going to supinate, and we're going to invert, just like that, right? So now I've got that position, and I come in to barrier. They go, oh, that's all I can take, like that. Back it off. And I go, okay, I'm backed off the inner barrier zone. They're having no pain. I say, raise your head. So go ahead and raise up there, tuck. They go, oh, yeah, I can feel it like that. I may have to come down a little bit. And then pretty soon I have her tuck. She goes, no, I can't feel it that way. And then when she comes down, I raise it a little bit. She says, I can feel it. I come back down. She comes up. We start flossing it back and forth through the peroneal nerve. We're trying to get that shin splint nerve